What got me though was the poverty and the challenges that's really concentrated in one area. A lot of the clients here, they suffer from mental health issues, substance use issues, lots of trauma in the past. The downtown east side really feels like a community, a neighborhood, and it really is a good place to work. My name is Valenciano. I'm a health services manager for Orange Hall, and our primary responsibility is to understand the needs of our clients coming in and then match them up to appropriate housing. The vulnerability assessment tool measures homeless individual across 10 domains. And so those 10 domains are specific challenges that homeless people experience. The tool was developed by Downtown Emergency Services Center in Seattle. And what they were trying to accomplish is they wanted to look at who their priority was. And so they were looking at who was most vulnerable. And we really liked that idea of looking at the most vulnerable in terms of making them a priority to our services. The biggest benefit for using the vulnerability assessment tool is we really get to understand the client's needs, their challenges from their own words. What the VAT does is measure their vulnerability objectively, where we can now understand what level of their vulnerability is and then match them to services. The VAT has been the primary tool to coordinate services amongst several providers, because what that has given us is a common language. Now that when we talk about individual clients and their challenges, we use the VAT in terms of explaining where that person came from, also what sort of services that they would need, and then really get them matched up to buildings and to services. BC Housing, we're in a unique position because we have been using it since 2012. And we were the first in Canada to really implement it system-wide. We've done multiple trainings with multiple service providers, and we've really developed the training session closely with DESC. We're also certified trainers by DESC, and they've really entrusted us in terms of getting the training out for not just Vancouver, BC, but then also nationwide. And what we're doing now is quite exciting. We have a new Canadian Vat Manual. So we're now using the VAT in more of a Canadian context. We're releasing it across Canada and also letting community groups know that if they want to be trained, to contact BC Housing so we could set up training in their local communities. The vulnerability assessment tool was evaluated by the Mental Health Commission of Canada and the Canadian Observatory of Homelessness. And so they really felt that the VAT was the gold standard for assessment tools. We're finding that we're the experts in VAT training, and a lot of the experience that we've gained through the thousands of interviews that we've done here, I think we're in a good position to really share that with service providers.